Welcome to the House Calls After Show. This is the show where after our main digital show on social media, we answer even more of your questions with our experts. And today, Dr. Lee Goldberg, who is a professor of medicine at the University of Pennsylvania, is back to answer your most pressing questions. Dr. Goldberg, thank you so much for joining us. We had a great show today, didn't we?
Yeah, thank you very much. The questions were amazing.
And so we're continuing this conversation about telehealth and telemedicine. And so for those who missed the main show, but who I'm sure will go back and watch the whole thing, just clarify for us, what's the difference between telemedicine and telehealth?
So telehealth is really the broad terminology that includes any number of technologies that we use to communicate, to educate. Sometimes it's medical team meetings, all of us coming together to discuss a challenging case, or patients using remote monitoring, for instance, of their blood pressure, their blood glucoses, et cetera. Telemedicine is more specific. It involves an interaction between a provider, say a physician or an advanced practice provider, and the patient directly. And so it's that one-on-one interaction that really defines telemedicine, as opposed to telehealth, which is really the entire field of using technology to promote better health, be it direct care or education, et cetera.
That's great. And so we had so many questions. We can always get to them on our main show, but lucky for you all, we have this podcast where we can answer even more of your questions. And so the first question comes from Connie from Wichita, and it's talking about heart surgery. Connie says, I worry that my elderly mother will opt for a telehealth visit when she experiences complications from her heart surgery that she had late last year. How do I help her determine if she needs to call 911 rather than schedule a telehealth visit?
So that's a great question. So first, when in doubt, your mom should reach out to her provider 24/7 and get advice as to what to do. So if there's any question. But I will say that there are some general rules of thumb. For instance, if someone is having worsening shortness of breath, or they're having fevers, or if they've had a recent surgery or procedure and the wound looks like it potentially could be infected, it's red or draining, if people have a fainting spell, if they have signs or symptoms of a stroke or change in their neurologic status, those are all reasons to call 911 and be seen kind of emergently. For most other things, calling into your doctor's office can enable the staff to work with you to kind of triage and decide, is this something that can be done over the phone? Is this something that requires a video visit? Or is this something that requires an in-person visit? Or in the worst case scenario, do you really need to come in now and potentially be seen in the emergency department?
Now, the next question is a really good question that I also have personally. Tamika in Silver Spring wants to know about spousal support in this sense. Can she join her spouse for a telehealth visit?
So the answer is absolutely. As a matter of fact, one of the strengths of telehealth has enabled us to bring more people into the visit. So sometimes in my practice, I'm bringing one of our nurses who does heart failure education, for instance, right there into part of the visit with us. And then I may step out and she may continue that. In terms of bringing your support, we absolutely want that to happen. And telehealth has actually made that possible. Perhaps your spouse is at work and can't break away to come to a face-to-face visit. Now they can join in for a telehealth visit, perhaps just for a much shorter period of time than it would take to take the whole day off or half the day off to do that. The one thing I will say is it's very important that the person who's having the visit give permission to whomever they want to be there. So your privacy is still important. And if there are things you want to discuss alone with your provider, then you should have the opportunity to do that. Just like in person, you can excuse those people, have them step out. We can do that also during a telehealth visit. And I think having that honest and open communication is really important. That being said, I think the visits are much more effective when I do have the caregivers there who may have a slightly different perspective or may hear something a little different than I'm explaining. And together, I always joke that the story is when everyone hears the same thing together, they each get a different part of it, but together they get the whole story. This is an opportunity to really leverage that. So we are looking for technologies more permanently in our telehealth program that will enable us to bring multiple people into the exam room, quote unquote, to enable us to leverage that. And we're not even looking at technologies that only allow kind of a one person to the provider alone, because we recognize that having the team, which includes your caregivers as well as our team together, is actually the most effective way to provide care.
No, that's really great. But I'm wondering too, how do you navigate that? Because some people are very private, but they don't have the luxury of privacy. So, how do you navigate that when you can maybe tell that a patient may be uncomfortable or they don't have the space to have that privacy?
Yeah. So one of the things that I do in my practice, I know some other providers do, is I always say you can always blame me, right? So kind of push the blame on the provider. So in this case, if you say, "Hey, my doctor wants to speak with me alone for a little bit, or has some personal questions they want to ask me, or wants to kind of hear my interpretation of the symptoms," that can be really helpful to kind of put it back on us to say, "Look, you're really important to this interaction, but there is a portion of it that I want to be able to do on my own."
Yeah.
We will do our very best to respect that. There are times when the situation is such that there just isn't that kind of privacy, and maybe that's when an in-person visit may be necessary, because then we can say to someone, "Hey, can you step out of the room for a little bit? Perhaps I'll do that during the physical exam," right, to give someone privacy. But that's also an opportunity for us to have a private conversation to say, "Is everything okay? Or is there something that you
Yeah.
want to talk about, not in front of another caregiver?" So it really depends. But again, be open, be honest. There are lots of ways to communicate with us. And so you can call the office, you can send us messaging through our portal, so that we can understand perhaps there's an issue, and we can work together to try and sort it out.
And I wonder too, with this next question, which is about phone calls, if that's a way to sort of finagle that. And they wanted to know, could they do telehealth medicine via phone calls, which may provide for some more privacy, I'm thinking.
Yeah, so it is possible to do some of this over phone. It's not nearly as effective as video. And even
Yeah.
our government and a lot of our insurers are kind of limiting how they'll allow us to use telephone contact. It's more like
Mhm.
a check-in. And you can assess symptoms and whatnot. I do that on call all the time. Someone calls with a problem and we work it out on the phone. But we have found that the video visits are much more powerful in letting us do a much higher level of assessment of individuals and try to close as much of that gap as we can between a face-to-face visit and a virtual visit. That being said, neither a phone or a video can be as good as in person for certain things. But a phone is possible. And if that's really important to you, I would rather you get care and do it on the phone than not get care at all. And we have made a policy in our practice that we will meet people wherever they are. So if they want to do phone, we do phone. We try our best to get them on to video if we can. But if we can't, then we continue doing their visit, because we'd rather engage them than not engage them at all.
So is the cost the same, a telehealth visit versus an in-person visit?
So right now, the rules really vary a lot by insurers, but the current waiver that we're operating on has created something called parity between a video visit and an in-person visit. So right now, the costs are the same, but so are the rules for the patient. So co-payments or co-insurance, et cetera, will be the same as if you had come into the office. That may change over time, but for now, that's how it is. The phone calls, some of the insurers are allowing parity for those visits. Others are using them as check-ins, and that's been changing pretty quickly. And it's been a little bit hard for us all to keep up with the changes. It feels like every few weeks there's another change. But right now, the video visits are parity. And initially, that was supposed to expire towards the end of June. And now it looks like that's been extended, and kind of extended with an open end date, meaning that as the pandemic continues to flare up in different parts of the country, and the need for telemedicine to connect with folks is so critically important, the recognition that we need to continue this, at least for a while, continue the waivers, they're staying in place. But at some point, they may disappear.
Gotcha. And this next question is advocating for telehealth, more telehealth, and says it's nice to be able to do remote visits for regular check-ins for my diabetes since I have to travel far on a bus to see my doctor. How can I advocate for this type of coverage in the future? Who can I talk to?
That is a fantastic question, and we appreciate the support, I will say. So first, letting your insurer know that you're interested in that. So if you have a private insurer, you have one of the Advantage plans where there's a company involved, communicating that company and letting them know as their customer that this is a service that you want continued is critical. But for many of our patients, they're dealing with things like Medicare and Medicaid in terms of their access to care. And in that case, it's really getting involved politically and letting our Congress people know, letting our senators know that this is really added a lot of value to our healthcare, and we need to find a way to incorporate it more permanently into the options for care that we have available. Again, we've been experimenting with telehealth for many, many years to extend ourselves to rural areas, to bring specialty services to areas where we didn't have providers that could do that. But it was really focused and limited and highly regulated and really restricted. And now we've seen that we can scale this to a lot of different situations where it can be more convenient. And it can also extend access to people who have a difficult time. Maybe they have a difficult time getting to us for physical reasons. They're exhausted or they're sore or they have other challenges to kind of navigate to get to us. If some of the visits were done virtually and some in person in a hybrid model, that would be ideal for certain populations. We're still figuring that out. So as I said at the end of the live show, we're really looking for feedback about where this works and where it doesn't. And I think we're going to have some unintended consequences. Some may be positive and some may be negative because we're figuring it out together. That being said, we love patient advocates who give us that feedback, but also speak to the policymakers and to the insurers so that we can continue providing these services.
That's really good to know. This is a really interesting question from Grace, who wants to know about traveling. Grace says, I'm traveling next month and think this telemedicine visit might work. Does it matter that I will be out of state for my visit?
So that is a great question. So it turns out that the licenses for our providers, our nurse practitioners, our docs, our PAs, are state-based. And so by law, we're not allowed to practice medicine in another state. And the way that the visits are defined is it's actually where the patient is. That's where the visit is occurring. So for instance, if you normally live in Pennsylvania and you go to Florida and then you do a visit with your doc, but the doc is in Pennsylvania and licensed in Pennsylvania, but you're physically in Florida, technically that physician needs to have a Florida license to provide that service.
How will you know?
So this is the tricky part. So for us in our office, we've been asking patients, where are you? And right now, because of the COVID emergency, many states have gone to either automatic reciprocity or many states have enabled us to apply for temporary licensure during this emergency. So for instance, for us in Pennsylvania, New Jersey has a program that enabled many of us to apply for temporary licensure so that we could provide telemedicine services literally from my window. I can see across the river into New Jersey. I can provide services there. But that's a temporary solution. So the other political or regulatory issue for us is, do we need a different way of licensure that enables us to practice more widely across state borders? And right now, there may or may not be the political will to do that. And there are some safety issues. You want to make sure that physicians that are practicing are not getting around regulations or not doing well. So I see both sides of the story. So this question turns out to be pretty complicated. Right now in our center, we literally have a web page that's updated regularly by our regulatory staff that literally tells us state by state where we're allowed to practice and where we're not allowed to practice. And if we have someone that's in one of those states that we can't, then we try to arrange some other, either to get care locally or to arrange for a face-to-face visit, et cetera. So it really depends on what state you're going to and what the situation is in that state and where your provider's licensed.
Very interesting. Last question is from Lenora regarding heart attack rehab. I was just discharged from the hospital 2 days ago after having a heart attack. My doctor talked about virtual cardiac rehab. Is that just as good, and should I try this program?
So that's another great question. So, we are still learning a lot about virtual rehab programs. There's been a couple of clinical trials that have shown that they can be safe and effective for the right person, meaning the person who is relatively low risk, doesn't need that hands-on monitoring during the rehab program. A cardiac rehab program that's done virtually can be very effective. And so my assumption is that if her doctor recommended it, he or she feels that the patient is low enough risk that it would be safe for them to do the rehab rehab. And interestingly, our center has been testing the use of a cardiac rehab app that actually acts as your kind of virtual coach in combination with a live cardiac rehab specialist. And together, they kind of encourage patients to gradually ramp up their physical activity, to report symptoms, to do a whole bunch of important education around risk reduction, risk factor modification, et cetera, and to really understand the signs and symptoms to look out for. So I think it can be amazingly effective for the right patient population. And this is an area where I do think that, we don't have enough rehab programs, and we don't have enough programs in rural areas where people have to travel great distances. This can really fill that gap. So we're learning a lot right now about how to do this in our own neighborhoods, but I anticipate that we'll be able to extend that to all kinds of places. So more to come on rehab. But my answer to this specific question is, if you have concerns, touch base with your physician. But if he or she thought it was appropriate for you, I would definitely give it a shot, because rehab is critical to your success, both short and long term. And in this situation where we may not have access to all the services during this pandemic, we want to make sure that we're providing the best possible care to everybody.
Doctor, this has been so helpful. In closing, is there anything that you want us to know around telehealth that we haven't asked?
Well, I would say that, again, as I said earlier, give us feedback about what's working and not working. And also be a little bit flexible. I will say that we as providers are learning the same as our patients and their families are. And so we have technical glitches. We have missteps when we're trying to figure things out. And sometimes we have to go to plan B and pick up the phone and make it a phone visit because we can't get the technology to work. So be flexible and be understanding. At the same time, don't be shy. If it is not working for you, tell us that. If you're not getting what you need or the reassurance that you need, please know that we're safe, we're open. We can see people face to face in nearly every hospital now in the country. We have protocols in place to keep everybody safe. And so if it's not working, please ask for and then come in for that face-to-face visit so that we can be sure that we're providing you that world-class care that you deserve.
You mentioned the technical glitches, and I would be remiss without asking this. Which medium or tool are you using, and are they all secure? Because there were concerns about Zoom and, people getting Zoom bombed and all that. So what safe and secure mechanisms are you using?
These are great questions. So in our center, one of the most important things when we started with the kind of ramping up very rapidly of telehealth was to have a secure platform, right? That we were protecting people's privacy. And there were pros and cons for that. So we used a particular vendor that required a lot of our patients to download an app on their phone so that we could make that secure connection. The advantage of that is that I felt very comfortable that it was secure. I was on the group that reviewed that security and met with the companies to discuss that. On the other hand, for some of our patients, they couldn't remember their password to know how to download an app. And we had many grandchildren and siblings, spouses, and kids helping our patients download the app. That was a disadvantage. Now, our center will move to a more permanent telehealth technology that won't require downloading the app and maintain security. So we had some early compromises just to get off the ground. I think many centers are doing the same. I will say that technologies like FaceTime and some of the other kind of technologies like Facebook Live, et cetera, where you're streaming on a social media platform or on FaceTime are technically not secure. And so our center is discouraging our providers from using that. I will say that there is a special waiver right now that is allowing us to use some of those technologies if we need to connect with a patient in order to, that's how important the video piece is. They're allowing that. But I suspect that will eventually go away. And I will say that as a leader in my center, I speak to providers all the time. I discourage them from using those platforms because we can't be sure they are secure. And I do really worry about that. And we've moved to other platforms. in the coming months, as we move away from the app-based and more like a point-to-point interaction with patients where they don't have to download an app and we can reach out to their device, I think it'll be easier for patients and secure for both patients and providers. And that's coming. And the technology is available. It's just taking us a little while to be able to scale it and implement it at the scope that we currently need, that we never anticipated we would need even 6 or 8 months ago. So that is coming. But that is a fantastic question. And there are several vendors now that have secure options available. And most of the big centers, including ours, are moving in that direction.
Dr. Goldberg, really appreciate you sticking around to answer some of these pressing questions, so critical. This after show is really the opportunity to get all those extra questions answered, and you were just great. And I want to encourage everyone to make sure you tune in next week for our live show, where we'll be talking about mental health and emotional wellness, which is so important during this time. And if you have questions, visit House Call's website at heart.org/housecalls, where you can find all of our previous shows, and you can also send us your questions for upcoming shows. I'm your host, Dia Smith-Taylor. Great being with you, and have a wonderful day.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.